Welcome to another deep dive. This time, into the current state of the healthcare industry. We've got a really interesting mix of sources lined up. News articles, some in-depth industry analyses, and we'll even touch on a personal reflection on digital wellness trends.
Sounds like we've got our work cut out for us. It's a pretty complex landscape out there.
Yeah, it is. But I think together we can break it down, uncover the key takeaways, and what it all means for the listener, the everyday person trying to make sense of it all.
Absolutely.
So let's just jump right in, starting with some of the financial strains hospitals are facing. Bellevue Hospital in Ohio, for instance, filed for bankruptcy, and Crozer Health in Pennsylvania went into receivership. So what's going on? What are the main factors driving these situations?
Well, the pandemic's definitely played a role. The impact is still being felt.
It's like we're still dealing with the aftershocks.
Exactly. Think about it. Delayed elective procedures, the supply chain disruptions, all the increased costs for things like protective equipment and staffing, that had a ripple effect.
Okay, so that's a big part of it. What else?
Well, we've got an aging population, and as people age, they demand, more healthcare services.
More services, sure. But on the flip side, there's a shortage of healthcare professionals,
Right.
like nurses and doctors.
Right, exactly. And that shortage puts even more pressure on hospitals. They have to pay more to attract and retain staff. Wages and benefits become, a real pressure point.
It's this kind of perfect storm situation.
Yeah, I guess you could say that.
And then on top of all that, hospitals are investing heavily in electronic health records, or EHRs. We're talking millions of dollars from what I've seen, like $15 million on the low end, all the way up to $800 million for some larger systems. So why such a huge range in cost?
Well, think about buying a car, right? A basic model is going to get you from A to B, but if you want all the bells and whistles, you go for the luxury option.
I see. So it's all about customization.
Exactly. Bigger hospital systems usually need more complex EHR systems with tailored features, more integration, things like that, and that obviously drives up the cost.
So is it worth it? We're talking about a ton of money here.
Well, in theory, EHRs offer immense benefits. You're talking about the potential for improved patient care, better coordination between providers, fewer medical errors, and from an operational standpoint, streamlined workflows, reduced paperwork, increased efficiency.
It sounds great on paper, but I've heard from some clinicians that these systems can be clunky and difficult to use.
Right, and that can actually add to their workload, which is already pretty heavy.
So it's not a silver bullet then.
Definitely not. There have been a lot of implementations that haven't lived up to the hype. And that brings us to the human element, which, let's be honest, is really at the heart of healthcare.
Yeah, no matter how advanced the technology gets, it's still about people caring for people.
Exactly. And this physician's call for the House of Medicine to speak out, to advocate against what they see as threats to compassion and understanding in healthcare, well, that's a pretty powerful reminder of what's really at stake here.
It's a reminder that even amidst all these financial pressures and rapid technological changes, we can't lose sight of the importance of empathy and understanding in healthcare.
Agreed. Now, let's shift gears a bit and talk about another trend we're seeing. Mergers and acquisitions. We've got Zimmer Biomet acquiring Paragon 28, and then there's Teladoc Health acquiring Catapult Health. It's a lot of consolidation. So what's driving this trend?
Well, it's interesting, right? Because both of those acquisitions are sort of revealing these broader shifts that are happening in the industry. The Zimmer Biomet deal, I think, highlights the growth of ambulatory surgery centers. They're becoming more popular, especially for certain procedures, because they're often more cost-effective and more convenient for patients.
And the Teladoc acquisition, that really points to the rise of telehealth. And that's a trend that's not going away anytime soon.
Definitely not.
Yeah.
But are these mergers and acquisitions a good thing for patients? Is it all just about bigger companies getting bigger, or is there more to it?
Well, it's a double-edged sword, right? Consolidation can potentially lead to lower costs, better efficiency, but it could also stifle competition, which could mean higher prices and fewer choices for patients. It's a trade-off.
It's something we need to keep an eye on for sure.
Absolutely.
So we've talked about financial pressures, consolidation. Now let's talk about technology's impact, which is huge, obviously, and specifically AI. Artificial intelligence is advancing so rapidly, it's almost hard to keep up.
It is.
And one area where it's making a big difference is in clinical documentation. This ambient speech technology, that's pretty amazing stuff. It's like having a virtual assistant transcribing your notes in real time. So could this help with clinician burnout? Do you think that's a possibility?
It could, for sure. It has the potential to free up a lot of time and mental energy for clinicians.
And we're also seeing these new AI models from companies like OpenAI that are more cost efficient, which is great. And then there's GitHub Copilot's new agent mode, which is another example of how fast this technology is evolving. But then there's this study suggesting that AI models might experience something like brain fog. That's a little concerning, right? Does that raise any questions about their reliability?
Yeah, it definitely raises some questions. I mean, we're still in the early stages of really understanding how AI works, its long-term reliability, what its limitations might be. And, blind trust is never a good thing. So we need to be critical, evaluate AI's performance, and make sure we're addressing any limitations.
So let's shift gears again. Now let's talk about government involvement in healthcare, which is another big topic. The VA is moving forward with a $330 million Oracle EHR rollout. So what are your thoughts on that? Is this a good thing for the VA? For veterans? Is it a risky move?
It's a big investment. There's no doubt about that. And it has the potential to improve efficiency, care coordination, but there's always the risk of disruptions, cost overruns if the implementation isn't handled properly. It's definitely a situation that needs close attention.
And then there's Elon Musk and his Department of Government Efficiency, or DOGE. I mean, they're gaining access to Medicare and Medicaid records. That sparked a lot of concern about data privacy and the potential for changes to these programs.
Yeah, it's a very controversial move. I think it really highlights this tension between efficiency and privacy. I mean, streamlining government operations and identifying waste. Those are good goals, but when you're talking about access to sensitive personal information like medical records, well, that inevitably raises concerns.
It's not just hypothetical concerns either. Multiple state attorneys general are actually suing DOGE over this access.
Right. And that lawsuit underscores the potential legal and ethical issues that come with integrating big data and AI into government-run healthcare programs. And, when you're talking about Medicare and Medicaid, programs that millions of Americans rely on, the potential impact is huge.
So amidst all this talk about big data, AI, technology, there's this kind of interesting counter trend emerging. I'm talking about analog wellness. People are looking for a balance. They want to disconnect from the digital world, engage in offline experiences, things like reading a physical book, spending time in nature, having face-to-face conversations. What do you think about this trend?
It's fascinating, isn't it? It's a real pushback against this constant digital stimulation we all experience. It makes sense, though, right? Sometimes you just need to unplug.
And it's even linked to the bookstore revival, which is another interesting trend. People crave that tactile experience, the human connection of browsing a physical bookstore.
It's a reminder that technology shouldn't completely replace real-life interactions.
Yeah, it's all about balance, right?
Absolutely.
Okay, so we've got financial pressures on hospitals, we've got rapid technological advancements, and now this growing desire for a more balanced approach to technology. It's a lot to unpack. So I guess the big question is, how does all of this impact the patient experience? I mean, is there a connection between the patient experience and overall health outcomes?
There's definitely a connection. When patients feel heard, understood, they're more likely to trust their healthcare providers, more likely to follow their treatment plans, which can lead to better management of chronic conditions, all sorts of benefits.
So it's not just about feeling good, it's about getting better results.
Exactly.
And I've read that there's a link between simplifying technology choices and improving patient engagement. Is that right?
Absolutely. When technology is user-friendly, it empowers patients. They can take a more active role in their health. Schedule appointments online, access their medical records, participate in telehealth consultations. They're more in control.
It makes sense. The easier it is to use, the more likely people are to use it.
Right.
Now, let's move on to a crucial aspect of healthcare, and that's health equity.
Yeah, let's dive into that. Access to quality healthcare shouldn't be a privilege, right? It should be a right. And we're seeing some positive steps, like this new law. It aims to provide Medicaid coverage to incarcerated youth after they're released.
Okay, so that's addressing a pretty critical gap in healthcare. That's good. But then I'm also seeing all these headlines about potential cuts to Medicaid spending. So how could that impact people with disabilities, for example?
Well, the concerns are valid. Medicaid is a lifeline for so many people, especially those with disabilities. And any cuts could have, devastating consequences. It could limit their access to essential services, widen those health disparities that already exist. It's a big concern.
And then there's this report about public policies and how they affect the LGBTQI plus population's health. It really highlights that need for equitable access for everyone, no matter who they are.
Absolutely. Healthcare policies need to be inclusive, address the unique needs of diverse communities. Everyone deserves compassionate and culturally competent care.
We can't forget about public health concerns either. I mean, we're seeing these measles outbreaks in Texas, and the battle against bird flu is still ongoing. It just never seems to end.
It's a reminder that public health measures, vaccination, these things are really important. It's interesting to look back at history. Think about President Johnson signing the Motor Traffic and Motor Vehicle Safety Act.
You mean back in the 60s?
Yeah, that was prompted by a public health crisis. Traffic accidents were claiming way too many lives.
And that led to changes, to policies that made cars and roads safer.
Exactly. So sometimes it takes a crisis to really push for meaningful change.
I'm kind of struck by this contrast we're seeing, though. On one hand, you have these massive companies making billion-dollar deals. But then on the other hand, you have individuals, everyday people, struggling to afford their medications. It's a pretty jarring juxtaposition.
It is, and it speaks to this fundamental question: is healthcare a business driven by profit, or is it a human right? It's a debate that's been going on for decades, and it just keeps getting more intense as healthcare costs continue to rise.
And technology just adds another layer of complexity, doesn't it? I mean,
Yeah.
how do we ensure that technology is being used to serve humanity, not exacerbate those inequalities that already exist?
Well, take AI, for example. Artificial intelligence has the potential to completely revolutionize healthcare, improve diagnoses, treatments, drug discovery, but we have to be really careful about potential biases.
Biases in the algorithms.
Yeah, think about it. These AI models are trained on data, and if that data reflects existing societal biases, well, those biases will be reflected in the algorithms too. It's a real concern.
So give me an example. How could that play out in real life?
Okay, imagine an AI model. It's
Yeah.
been trained primarily on data from white males. Now, that model might not be as accurate or effective for women or people of color. It's a problem.
So diversity and inclusion are really important when we're talking about developing and implementing AI in healthcare.
Absolutely. It can't be an afterthought. We need to make sure these technologies are trained on data that represents the full spectrum of human diversity. Because AI is a tool, it's not a magic bullet. And like any tool, it needs to be used carefully, intentionally.
And we need to make sure the patient's voice is being heard throughout this whole process.
Absolutely. Patients are the ones who experience the healthcare system firsthand. They're the ultimate stakeholders. Their perspectives, their experiences, they're invaluable. We need to listen to them.
This article I read about providers struggling with patient collections, it's just another example of how complex things are becoming. Even billing is getting more complicated.
Yeah, it's true. With these high-deductible health plans, patients are responsible for a much larger portion of their medical bills. And that can be really confusing, frustrating. It can lead to financial hardship.
And for providers, it creates a whole new set of challenges. They have to spend more time and resources trying to collect those payments.
It's a tough situation all around. I mean, providers need to be paid for their services, obviously. But when patients can't afford to pay their bills, it strains the entire system.
So what are some potential solutions? I mean, how do we fix this?
Well, we need more transparency in healthcare pricing. So you, the patient, you understand what things cost up front. No surprises. We also need to think about innovative payment models, ways to make healthcare more affordable, more accessible.
And what about financial literacy for patients? I mean, if they have a better understanding of their insurance coverage, their financial obligations, maybe that would help.
Absolutely. Empowering patients to be active participants in their healthcare journey. That includes understanding the financial aspects.
It seems like the healthcare landscape is changing so rapidly, and all these changes have a huge impact on everyone involved. Patients, providers, policymakers, everyone.
And it's not just limited to the United States either. Countries around the world are grappling with similar challenges. Rising healthcare costs, aging populations, the need for greater equity, better access. It's a global issue.
And with the 24/7 news cycle, social media, we're constantly bombarded with information about healthcare. I mean, it's coming at us from all directions. So how do we even navigate this constant influx of information? How do we know what to believe?
Critical thinking is crucial. You have to evaluate information, question your assumptions, be willing to consider different perspectives. Don't just blindly accept everything you read or hear. Be discerning, especially when it comes to your health.
So as we continue to explore this topic, the state of healthcare, approaching these issues with an open mind, a critical eye, that's really important.
Yeah, I think so too. Embrace the complexity, acknowledge that there are no easy answers, and be willing to have those tough conversations, even with people who hold different views.
It's not about finding the right answer. It's about understanding the challenges, the opportunities, and working together to create a system that actually benefits everyone.
And at the end of the day, healthcare is about people. It's about caring, compassion, that fundamental right to health and well-being.
And those values, those should be guiding our decisions, our policies, our interactions as we work towards a healthcare system that actually lives up to its name.
Right, and it's not just about these sweeping changes. It's also about those small acts of kindness, of
Uh,
compassion.
a listening ear, a helping hand, a moment of empathy. Those things matter, especially in a field like healthcare, which is so personal, so impactful.
Exactly. We're all in this together. Patients, providers, policymakers, everyone. Our health, our well-being, it's all interconnected.
So let's move forward with that sense of shared humanity, recognizing that the choices we make, the policies we support, the care we provide, it all has a profound impact on others.
We need to strive for a healthcare system that's not just effective, but also compassionate, equitable, truly patient-centered. That's the goal.
Now, I want to shift gears a little bit and talk about some of the really exciting developments happening in medical innovation, particularly in gene editing, personalized medicine, these regenerative therapies. I mean, these breakthroughs have the potential to completely transform how we prevent, diagnose, and treat diseases.
It's amazing. We're talking about advancements that could not only extend lifespans, but also improve the quality of life for countless individuals.
Look at the progress we're making in cancer research, for instance. These immunotherapies. They harness the body's own immune system to fight cancer cells, and they're showing incredible promise.
And there are new drugs and treatments being developed all the time. It's remarkable.
And it's not just cancer. We're seeing breakthroughs in Alzheimer's disease, Parkinson's disease, so many chronic conditions. It's really astounding.
And artificial intelligence, machine learning, these tools are allowing us to analyze huge amounts of data, identify patterns, and develop personalized treatments, treatments that are tailored to the individual.
So we're talking about precision medicine.
Exactly. It's incredibly exciting. But as with any new technology, there are ethical considerations that need to be addressed.
Right. I mean, we have to make sure these advancements are available to everyone, regardless of their socioeconomic status, their race, their ethnicity.
Absolutely. And we need to consider the potential risks, any unintended consequences. We need to be thoughtful about this.
And have those open and honest conversations about the implications for society as a whole.
Definitely. Because these aren't just scientific questions, they're ethical, social, philosophical questions. And they require careful consideration.
So as we marvel at all this progress in medical innovation, let's not forget to prioritize that ethical and equitable implementation.
Right. Let's make sure these advancements benefit all of humanity and create a future where everyone has the opportunity to live a long, healthy, fulfilling life.
I've been thinking a lot lately about the role of personal responsibility in healthcare. It's a topic that always seems to spark a lot of debate.
It's a tricky one. There's this tension between individual accountability and the impact of societal factors.
So some people believe that individuals should be held accountable for their health choices.
Right.
If you smoke, if you don't exercise, if you eat unhealthy foods, you're responsible for the consequences.
Right. But then others emphasize the role of social determinants of health. Things like poverty, lack of access to healthy food, safe housing, quality education. These factors play a huge role.
So it's more nuanced than just saying it's your fault if you're not healthy.
Definitely. While our choices about diet, exercise, things like smoking, they obviously have a big impact on our health, it's important to acknowledge that not everyone has the same opportunities to make healthy choices.
It's not a level playing field.
Right. Imagine living in a food desert,
Right.
where fresh produce is scarce and fast food is everywhere. It's hard to maintain a healthy diet in that environment.
Or what if you're working multiple jobs, you lack access to affordable childcare, it's tough to find the time and energy to exercise.
Exactly. So personal responsibility is important. But we have to recognize those systemic barriers that prevent so many people from achieving optimal health.
So how do we address those barriers? How do we create a more equitable playing field?
We need policies that promote health equity. Investing in affordable housing, expanding access to healthy food options, creating safe spaces for physical activity.
Addressing those social determinants of health I mentioned earlier, poverty, discrimination, lack of education. All of these things contribute to health disparities.
It's about creating a society where everyone has the opportunity to thrive, not just survive. And that includes providing access to the resources and support they need to make healthy choices.
So it's not about blaming people for their health problems. It's about supporting them.
Exactly. Let's move away from judgment and shame and focus on providing support, encouragement, and access to the tools and information they need to make positive changes.
Create a healthcare system that not only treats diseases, but also prevents them, promotes overall well-being.
Right. And that means moving beyond that traditional medical model, embracing a more holistic approach that considers the physical, emotional, social, and spiritual needs of each individual.
Okay, so let's talk about the role of government in healthcare. That's another one of those topics that tends to generate a lot of strong opinions.
Yeah, it's a big one.
You have people who advocate for more government involvement. They say the government should play a bigger role in providing healthcare. And then you have others who believe that healthcare should be left primarily to the private sector.
It's a complex issue, and there are valid arguments on both sides. I think the best balance, the right balance between government involvement and private sector innovation, it probably depends on the context.
In the U.S., we have this mixed system, right? We have
Sure.
government-funded programs like Medicare and Medicaid, and then we have private insurance.
Right. And that's led to a really fragmented system. It's confusing, it's expensive, and access to care isn't equal for everyone.
And one of the big debates is whether we should move towards a single-payer healthcare system, where the government would be the sole payer for all healthcare services.
Yeah, that's a big one.
Proponents of single-payer say it would simplify the system, reduce administrative costs, and ensure that everyone has access to care, regardless of their ability to pay.
And opponents worry about government bureaucracy, longer wait times, limited choice. They have their concerns too.
It's a really complicated issue. There are no easy answers.
That's for sure. But as a society, we need to keep having this conversation, keep exploring different approaches.
Because the goal should be a healthcare system that's affordable, accessible, and high quality. And whether that's achieved through a single-payer system, a mixed system, or some other model, that's a decision we need to make together.
And I think it's important to remember that healthcare is not just a policy issue. It's a human issue. It's about people's lives, their health, their well-being. We need to approach this topic with compassion, with empathy, with a real commitment to finding solutions that work for everyone.
Let's talk about the healthcare workforce. It's a big issue. I mean, we're facing this growing shortage of healthcare professionals across the board. Physicians, nurses, technicians, support staff, everyone.
Yeah, it's a real crisis, and it's caused by a lot of factors: the aging population, the increase in chronic diseases, and we haven't really invested enough in healthcare education and training. We need more people entering the field.
And this shortage has a ripple effect, right? It impacts patients, providers. It's a big problem.
Yeah, it is. For patients, it could mean longer wait times, reduced access to care, and potentially even lower quality of care.
And for providers, it's burnout, stress, compassion fatigue. They're being asked to do more with less. It's not sustainable.
It's not. So what can we do about it? Well, we need to invest in healthcare education and training, make it more affordable, create incentives for people to enter the field and stay in the field.
We need to make it a more attractive profession.
Right. And maybe we need to explore some innovative models of care: telehealth, team-based care, community health workers. These could all help alleviate some of the burden on existing healthcare professionals.
And what about addressing burnout? I mean, the system itself is kind of set up to create burnout.
It is. We need to address the root causes: the excessive paperwork, the administrative burdens, the lack of work-life balance.
We need to create a culture of well-being in healthcare, where providers feel supported, valued, where they have the resources they need to do their jobs well.
Absolutely. We need to create a system that benefits both patients and the people who care for them.
Okay, so as we wrap up this deep dive, it's clear that the healthcare industry is facing a lot of challenges, from financial pressures to technological disruptions to this workforce shortage we've been talking about.
Yeah, that's a lot.
But I also feel like it's a time of great innovation and opportunity. All these advancements we've talked about, the growing emphasis on patient-centered care, the commitment to health equity, it gives me hope.
Me too. I think there's this collective will to create a healthcare system that's more equitable, more accessible, more responsive to the needs of individuals and communities.
The future of healthcare may be uncertain, but one thing is for sure: we have to work together to create a system that's affordable, accessible, high quality, and equitable for all.
It's a tall order, but it's one that deserves our best efforts. And as we move forward, I think it's important to remember the words of that physician who called for the House of Medicine to speak out against threats to compassion, understanding, Silence is not an option.
We all have a role to play in shaping the future of healthcare. By staying informed, engaged, compassionate,
Hmm.
we can make a difference.
And those small actions, those small acts of kindness, they matter. They really do. They can create this ripple effect, make the world a more compassionate, caring place. And in a field like healthcare, that compassion can make all the difference.
Yeah, those little things can really add up. It's a good reminder that we all have a part to play. We talked about AI and how it's impacting clinical documentation, but technology is also changing healthcare delivery in so many other ways, like telehealth, for instance. That's been huge.
Yeah, it's pretty amazing to see how telehealth has taken off. I mean, it was already growing before the pandemic, but those times really, accelerated everything.
It's not just a matter of convenience anymore either. It's about reaching people who might not have easy access to healthcare,
Yeah.
like in rural communities or underserved areas where it might be hard to get to a doctor's office.
Yeah, exactly. It's like bringing healthcare directly to people's homes. You're not limited by geography anymore.
And it's not just virtual appointments either. We're also seeing things like remote patient monitoring.
Oh, yeah. That's really exciting. Using wearable devices, sensors, that sort of thing, to collect data on people's vital signs and send it back to their healthcare providers.
So it's all about being proactive, catching things early, maybe even preventing hospital readmissions.
Exactly.
It sounds like we're moving towards a future where healthcare is more personalized, more accessible. But are there any challenges that come with all these advancements, things we need to be careful about?
Oh, for sure. I mean, data, privacy, and security, those are huge. We're talking about people's health information, really sensitive stuff. So we need to make sure that data is protected. And then there's the issue of integration, making sure these technologies work seamlessly with the systems that are already in place. We don't want to add more work for providers who are already stretched thin.
Right. And what about the digital divide? I mean, not everyone has access to reliable internet or even the devices they need to use these technologies.
Yeah, that's a really important point. We need to bridge that gap. Otherwise, technology could actually make those health disparities even worse. Everyone should have the opportunity to benefit from these innovations. It shouldn't just be for those who can afford it.
Speaking of equity, there's been a lot more attention paid lately to the social determinants of health. All those factors that influence a person's well-being that go beyond traditional healthcare. Things like where you live, your income, your education level.
Yeah, it's a really crucial shift in how we think about healthcare. We're finally starting to recognize that it's not just about treating diseases. It's about addressing the root causes of those diseases, the social and economic factors that can make people sick in the first place.
It's about creating a society that actually supports health and well-being for everyone, not just a privileged few.
Exactly. And that requires everyone to work together. Healthcare systems, community organizations, social services, policymakers. We all have a role to play.
It's a shared responsibility.
Yeah.
So as we wrap up this deep dive into the healthcare industry, I'm really struck by how complex it all is. There are just so many moving parts, so many different perspectives.
Well, healthcare is a reflection of society, right? It shows us where we've made progress, and it also exposes the areas where we still need to work.
But despite all the challenges, I also get this sense of hope. The advancements we've talked about, the commitment of all those healthcare professionals out there working so hard, and this growing awareness of the importance of health equity. I think all of that points to a brighter future.
I agree. There's a real sense of momentum, this collective effort to make healthcare more equitable, more accessible, more responsive to the needs of individuals and communities.
We've come a long way, but there's still a lot of work to do. So what's the takeaway? What do we want listeners to remember from this deep dive?
I think the key takeaway is this. The healthcare landscape is always changing, and navigating that change requires us to stay informed, to engage in these conversations, and to be willing to challenge our assumptions. There's no one-size-fits-all solution.
We need to be open to new ideas, new approaches. But at the heart of it all, healthcare is about people. It's about caring for one another.
Yeah, it's about compassion, empathy, and recognizing that we're all in this together. We have to support each other, and we have to advocate for a system that truly serves everyone, not just some.
That's a great message to end on. Thanks for joining us for this deep dive into the healthcare industry. It's been a fascinating conversation.
My pleasure. And to our listeners, thanks for tuning in. Keep asking questions, keep learning. And remember, your voice matters. Even small actions can have a big impact.
That's right. Every little bit helps. So until next time, be well, stay informed, and let's keep working towards a better future for healthcare. For everyone.